Hello and welcome. I'm Dr. Keith Lynch. I've been in private practice here in Central Virginia since 1998. Today we're going to talk about natural solutions for carpal tunnel syndrome. Now, carpal tunnel syndrome typically affects the median nerve as it goes into the through the wrist into the hand. This diagram here shows the red portion of the hand. Typically these three fingers are the area that get involved with carpal tunnel syndrome, as well as down into the palm surface here. Now this white area on the other side is the ulnar nerve that gives sensation to that area. And then down at the bottom here where we're showing the transverse carpal ligament, which goes across that median nerve as it goes into the hand, there's another branch of it that they're showing that comes across it called the palmar branch of the median nerve, and it gives sensation to the thumb area. So oftentimes patients will come into me and they'll either say, yeah, I think I have carpal tunnel, or they say, yeah, I've been diagnosed with carpal tunnel. And if you come in and you're telling me that, and this area here is involved, and or this thumb area is involved, I'll probably be telling you that I think it's a multiple crush injury versus carpal tunnel, because carpal tunnel affects the carpal tunnel, which is right here. The ulnar nerve has its own tunnel that it goes through called the tunnel of Guyon, and then of course we have this other nerve which goes above the tunnel. Now one thing that they'll do when they're testing that area is they'll do a nerve conduction velocity test across this area of the wrist and hand and say, yeah, that median nerve's being affected. We have less conduction from one side to the other. My question is, in our office, when we evaluate it, we look all the way upstream because the median nerve doesn't start here. It starts up here, way up here in the neck. And it becomes part of branches of several of these spinal nerves coming off of the neck, come together, and that's what forms the median nerve down here. You can see these nerves come out, they scoop underneath this collarbone right here, then they go down through the arm, in through the elbow and wrist, all the way down into the hand, and that's where I call the business end of that palmar median nerve. So you have to evaluate this area properly, you've got to look all the way upstream, taking into account everything that can affect that nerve all the way through there until it gets to the actual carpal tunnel. Now the tunnel itself is made up of these bones in the wrist area right here. They form the bottom portion of that tunnel, and then we have the flexor retinaculum and the transverse carpal ligament which go across, forming the roof of that tunnel. Over here you can see a separate tunnel that they're showing. That's where your ulnar nerve passes through that tunnel of Guyon, as we mentioned earlier. Oftentimes what's happening with carpal tunnel is repetitive stress injury causes these carpal bones to drop or fall forward and move out of position. You see, when you think of your wrist is one of those joints that moves really well. So because of that motion and that ability to move, it also has the ability to misalign. Just like jamming a finger, you can jam that wrist and move things out of their proper position through catching yourself from a fall, different sports, different other activities such as working with hammers, drills, tools. Those can all cause carpal tunnel syndrome. Whether or not you're a butcher or a typist or a carpenter, everybody these days uses their hands. I use my hands all day long, so I'm well aware of this, and I see and work on this whenever I find it on patients as well as myself to get those bones back to their proper position and off those nerves going through the hands. Because if you have pressure on those nerves, you're going to have weakness. You're going to have numbness or tingling, or you'll have pain, or you'll have a combination of those sensations, maybe pins and needles. So the idea is to find out where it's being caused from, because it may be carpal tunnel, and we may be able to help you with your carpal tunnel. In our office, besides adjusting those bones off of that nerve root, we also use a percussion instrument. Now we do that because we want to release scar tissue adhesions. The outside covering of your muscles has a glycoprotein or a sugar protein, and when you have repetitive stress injuries, those glycoproteins have a tendency to break down and stick together or adhere. Those adhesions are what create scar tissue. When scar tissue builds up in this area, it can limit range of motion, and it can pull on blood vessels and nerves as they move through that area. So it's important that that gets addressed. Now the other thing that we do in our office is we also use cold laser. Cold laser has been FDA approved for carpal tunnel syndrome since about 2002. We've been using cold laser successfully in our office since 2006. So I know the ins and outs of how to use it, where to use it, and how to get the most benefit from it. So if it's not just in the wrist, if you're having symptoms up into that forearm or higher, then I'm going to tell you that it's more than likely going to be a multiple crush injury, possibly pronator teres syndrome. Because in pronator teres syndrome, remember that median nerve starts way up here in the neck, and then it runs down through the arm and elbow down to the hand. Well, your pronator is, if I have my arm out like this and my palm is up, to bring that palm down, that pronator teres has to do that. And that's its function. It brings that hand down. So there's a lot of activities that we use that hand doing that, and that can create scar tissue in that muscle that'll literally grip onto that median nerve and start causing a pinch right in here. So that's why in our office, we're always looking upstream to see where else this problem could be getting caused by. Because even if you say, well, I don't have any pain in my neck, or I don't feel any problems in through here, when we look at a cross-section of a peripheral nerve, only 10% of it has pain fibers. So if I told you we were going to go outside and there's a 1 in 10 chance that we're going to see something, you'd probably think, well, there's not very good chance that I'm going to see it. If I told you that there's only a 1 in 10% chance that you're going to feel it, that's the situation. Well, then why are you feeling it down here? Because when there's a multiple crush injury, what happens is wherever that starts, it's going to start up here and it's going to make that nerve from here down a little bit worse. But then if there's another crush up here in the shoulder, it'll get worse again, and then get worse again through the pronator, and then by the time it gets down to the wrist, you don't have a lot going through there to start with. So you're going to have, out at what I call the business end of that median nerve, that's where you're going to have the problem. You may not feel it so much further up. Now, some people will. Some people are going to feel the motor portion of that nerve and say, well, I feel like it's weaker, not just in the hand, but up here as well. Or you're going to have fatigue or spasms or tightness. Those would be the things I'd be listening for from you to find out what's actually causing the problem. Now, surgery is not the only option. But if you go with surgery, you should know that what they're going to do is they're going to cut that transverse ligament, and then you're going to have to do rehab after some downtime. And there's also going to be scar tissue formation in there. With surgery, there's never any guarantee. That's really the bottom line with it. Because once you have surgery on an area and they cut it open, it's never really going to be the same afterwards. And it could be the scar tissue that forms there that sometimes later comes back and gets you, and you go, yeah, I'm getting that back in that hand. I had carpal tunnel surgery on it. And I know this because I've taken care of tons of people who have the surgery scar there, and they've had the condition come back later in time. maybe it's 2 years, maybe it's 5 years. But they usually come in with other issues up into that arm and shoulder. Oh yeah, and that hand start and act up again too. So although surgery looks like an option, it's not always the best option. I would always do something less invasive first, and that's the whole point of educating you about this right now. Because our approach is different. First of all, our procedures are pain-free. All of our adjustments are done with instruments, so there's never any twisting, popping, or cracking. We see immediate changes. So when we do our examination, we're going to actually identify which areas are causing the problem, and typically there'll be weakness there as well, and we'll see a strength improvement of about 30 to 50% immediately after the first correction. Now, does that mean you're going to be immediately pain-free right after we get started? Usually not. The body takes time to heal, so there's a time frame for every condition, and I won't know what that is in your case until after we do a proper examination on it. But you'll see those changes. There will not be a scar that gets put in there, and there won't be any downtime. And those are some of the great benefits of what we do here in our office. So my offer to you is this. If you come in and talk with me about this, we'll sit down. I'll ask you how it started. What activities make it worse? What makes it better? What activities are you doing now that you're concerned about that you may not be able to do in the future? Do you have a hard time with small activities like buttoning a shirt or a blouse? Or is it opening a jar? What things are actually giving you trouble so that we can even set goals as to let's make sure that you get to that point where you can do those things properly. We'll also do a comprehensive examination where I'll do orthopedic and neurological examination tests on you to be able to pinpoint where the problems are. We'll take any necessary films, and then after all that, I'll give you a written report telling you exactly what I recommend, how much, how long, how much insurance is going to cover for you, how many times you need to be here to get the treatment. All of that will be written out for you before we do any treatment so that you know exactly what to expect. And I'll do all that for you for $77 if you've watched this video and have been pre-educated on what we do here. Because these services normally cost $249. If I take 2 x-rays, that's going to be $80 right there. So I'm trying to make this very reasonable for you to come in and get a second opinion on your condition so that you'll know whether or not this is something that can help you and you can take care of this without medication and without surgery, because that's really our goal. Now, this offer does exclude federal beneficiaries. So what do you need to do? Call our office at 434-245-8456. Tell my staff you want our carpal tunnel evaluation. They'll get you set up for that appointment. I look forward to meeting you, and I look forward to helping you. Thank you.